Benedicts test. So here the Benedicts test is a test for the reducing sugars. So here basically the Benedicts test is negative in case of non-reducing sugars, such as in case of sucrose. The principle here is that the all monosaccharides and they are reducing disaccharides, they contain something, the aldehyde, which is a free functional aldehyde is present, or there is a presence of the ketone group. So when heated in presence of an alkali, they are converted to something known as the inidiols. So what this inidiol does is that it acts on the cupric ions. So it reduces the cupric ions, that is the Cu2 plus present in the Benedicts reagent, and it forms an insoluble red cuprous oxide, that is Cu2O. So basically there is something known as the inidiols. It reduces the cupric ions, that is Cu2 plus, to the in presence of the Benedicts reagent, and it is converted to the red cuprous oxide, that is the Cu2 plus, Cu2O. And next we are looking at is the composition. Composition includes the copper sulfate. Copper sulfate, it provides the source for the cupric ion Cu2 plus, and the sodium citrate, it complexes with the cupric ions to prevent the deterioration to cuprous ions spontaneously. And then is the sodium carbonate, and it provides the alkaline pH. Now we are looking at the glucose, galactose, fructose, so these are the substances which act positive. So in case of monosaccharides is glucose, galactose, fructose, pentose, reducing disaccharides, lactose, maltose, and next also the glucuronic acid, homogenesic acid, as well as the ascorbic acid. Next we are going to look at the color of the precipitate, which gives a rough idea of the amount of sugars which are present in the urine. So due to this property, it is a semi-quantitative test. So the color, it goes by green, and next there is yellow, and next there is orange, and there is red. It is a sequence of Vibgyor. So the the green is 0.5 amount of the reducing sugars, yellow is 1, orange is 1.5, red is 2. Orange 1.5 and the red is 2. So this depicts the amount of reducing sugars based on the color.